All right, I think we'll go ahead and get started. Greetings from Austin, Texas. My name is Victoria DiFrancesco Soto, and I am the Assistant Dean here at the LBJ School of Public Affairs. This year, we turned 50, and throughout this landmark year, we celebrate the LBJ School's half-century of impact, not just within the walls of the Academy, but in the arena. And in celebrating, we want to bring you our new series, a live virtual series every noon on Wednesdays in the arena, bringing together world-renowned policy experts and frontline stakeholders to serve and inform during this unprecedented global crisis. Today, we will unpack the economic crisis set off by the COVID-19 pandemic. With me today, I have the pleasure of being joined by two of my colleagues at the LBJ School. James Galbraith is the Lloyd M. Benson Chair in Government and Business Relations. He is the former Executive Director of the Joint Economic Committee of the U.S. Congress and one of the most beloved professors here at the LBJ School. And Michael Lind, a professor of practice, co-founder of New America, and one of the foremost public intellectuals of our time, appearing in all major publications and author of over a dozen books, with his most recent one, The New Class War, Saving Democracy from the Managerial Elite, that came out earlier this year. Thank you, gentlemen. Let's dig in. And I want to start the conversation by looking at numbers, some really alarming, record-breaking economic numbers. 17 million Americans have sought unemployment benefits in the last 3 weeks. And then last week alone, that number was 6.8 million. The US deficit will swell to historic highs, and the debt to GDP ratio will pass the record set previously during World War II. I could go on. There are a lot of bad numbers, but I want to turn to you, Jamie, because you recently wrote in The Guardian, you said that these economic numbers don't matter right now, not to worry. So I want you to explain this, just because at first sight, it's counterintuitive. It goes against what the head and the heart initially want to in terms of going to that worry zone. But walk us through why these economic numbers right now should not be worrying us, and instead what numbers we should be focused on.
Okay, thank you very much, and thank you for hosting this and for organizing these series. Right now, we're in the middle of a public health crisis, a pandemic. It's a pandemic with very specific characteristics. It spreads very rapidly, and it's influenced. The spread can be slowed and eventually stopped. We know from the experience around the world, and also the beginning of the experience here, by effective measures called social distancing, effective measures of quarantine, of testing, and basically breaking the chain of transmission of the virus. That is the essential priority. That is, in fact, the overwhelming priority of the present situation. The economic numbers that we are seeing are artifacts of the effort, the common effort that we're making to battle the pandemic. And as a result, it was necessary to basically hit the pause button for a great share of economic activity. It was necessary to find some means, and I don't think we necessarily chose the best ones, but to find some means of supporting the population that is temporarily out of work. And it will be necessary to sustain the population that has to be at home with essential supplies and particularly with food and so forth, for as long as necessary to make this process work. So that's one thing that matters. And the other thing that matters, and matters even more, is that it is necessary to make sure that our medical system stays ahead of the flow of people who are becoming ill from this virus. And that we have the essential supplies available to the healthcare workers and to the patients, the beds, the ICU units, the ventilators, the protective equipment that are necessary to deal with effectively the casualties of the pandemic. Those are the things that matter. Again, the fact that we have many millions of people taking unemployment insurance is a consequence of decisions that we've had to take that perhaps we shouldn't have had to take if we'd been better prepared, but that we've had to take. And it's a good thing, not a bad thing, that people are getting some assistance to get through this period. What will happen afterwards, of course, is another question, and I'll come to that in due course.
Right, so these economics will be dealt with at a later point, but the numbers that matter right now are the health figures, which takes me to my next question, because I know both of you have written on the idea of creating a health finance corporation, that this is really how we need to come at the pandemic and the economic shortfalls that come out of that. A government corporation modeled after the Reconstruction Finance Corporation that supported the New Deal and then the World War II mobilization effort. So, Michael, I'm going to turn to you to give us the broad contours of what a health finance corporation would look like.
Well, as you say, Professor Galbraith and my proposal for a health finance corporation was modeled on the Reconstruction Finance Corporation of World War II. Earlier, it had been used during the Depression to recapitalize businesses, invest in infrastructure, help out state and local governments. And the Reconstruction Finance Corporation in the 30s and 40s, in turn, was inspired by the War Finance Corporation of World War I. Not to get too much into the details, but the advantage of having a government-owned corporation delegated the authority to do economic mobilization in some cases in World War II, which is perhaps the most important analogy, to be able to set up subsidiaries to ramp up manufacturing of critical goods and to allocate them. In this case, it would be medical manufacturing and medical supplies in the supply chain. The corporation has two advantages. One, while it's subject to government oversight, it's got more flexibility than conventional government agencies in an emergency. And second, it can be designed to be able to access funding on its outside of regular appropriations. Now, unfortunately, in my opinion, Congress and the White House have chosen not to go this route. Essentially, we're relying on the Federal Reserve to do emergency spending to rescue the economy during the shutdown. And there have been a series of short-term task forces handling, not very well, in my opinion, the allocation of medical goods among the federal government, the states, and hospitals.
So in essence, instead of these smaller task forces, having something, a uniform organization here, the Health Finance Corporation, to marshal all of these resources. Jamie, help us think through what effect a Health Finance Corporation would have on the day-to-day lives of Americans right now. So that small business owner who's been shuttered, that worker who's been laid off, now doesn't have health insurance and maybe has fallen ill with COVID-19. So what are the effects of this kind of amorphous, big bureaucratic entity of the Health Finance Corporation on the lives of Americans?
Well, let me first of all just place that question in a bit of context. I think what we've seen in the response so far by the federal government, aside from its obvious deficiencies of chaotic disorganization and ineffectiveness in important respects, is a response that has been governed by the view that this is fundamentally a short-term problem, which can be dealt with by a series of ad hoc measures, and which doesn't require, and where the response that requires authorizations or appropriations can be handled by the ordinary processes of the Congress. And the fact is that both of these assumptions are wrong, because the underlying premise that this is a short-term issue is not correct. It's not going to go away in a few weeks, and I say this on a completely bipartisan basis, by the way, that it's not going to go away in a few weeks. We're going to be faced with we have an initial phase, which is a crisis phase, when we were short of medical supplies and we were short of hospital beds, and we had a crush of patients coming in. That had to be dealt with. We're barely ahead of that problem now, and it's a very close run thing, very close run thing in the epicenters of the crisis in New York, in particular, in New Jersey at the moment, and in Louisiana at the moment. But that problem will be and is gradually coming under some degree of control, particularly as the first wave of the pandemic passes. But then there's the second phase. And the second phase is going to continue so long as we don't have either an effective therapy or a vaccine. And that could be a matter of months, it could be a matter of a year, it could be a year and a half or 2 years before we're in that situation where we can really truly be free and clear of this particular problem. The phase after that will still be influenced, but we have this immediate issue that has to be dealt with, and has to be dealt with on a longer term basis, and has to be dealt with in a way which is responds to the problems as they arise. The advantage of the proposal that Michael and I put forward early on, which is to put this in the model that the Reconstruction Finance Corporation was created under President Hoover, expanded under President Roosevelt, went right through the war and into the 50s, and did some very remarkable things. It was responsible, for example, for the second largest industrial project in the war mobilization, which was the synthetic rubber industry, and did a great many things before that and a great many things afterwards. It was building civil defense hospitals into the 1950s. Is that you have, under the leadership of a let's say, of a trusted figure. In the RFC case, it was Jesse Jones, an epic Texas businessman who built the city of Houston effectively, and whose name is on one of our buildings here at UT. And with a board that is bipartisan and has effective oversight, it can move very quickly, has its own source of finance, and it can make decisions on that are centered on the trusted and trustworthy word of professional scientific experts, in this case medical experts, which is what we need. And so our view was this would accelerate the process of dealing with, first of all, the crisis phase, medical supplies and allocation of resources in that, and get out of the business of having state and local governments making all of their own procurement decisions and competing with each other and having middlemen who would be able to run up their prices in the process. That it would then also enable us to have a more coherent management of this second phase, which is the containment phase, which is the phase of keeping people safe and healthy and happy and at least satisfied in their homes so far as it's possible to be, while the overall economy is still not not functioning and as we would hope it would. And at the same time, absolutely crucial thing of assuring that the supply chains that we need, the food supply chain, basic medicines, but especially the food supply chain, continues to function. And there's a big question there of the safety of the workers, the safety of the customers. Contamination is emerging in some parts of some plants and in the distribution centers. This has to do with in fact, some companies are handling this relatively well, others perhaps not so well. That would be very, very helpful to have kind of an oversight mechanism and an emergency response mechanism to make sure that the workers are protected, that they're paid adequately, and that we are able to get through that second phase, this rather long phase, without having a really severe crisis in parts of our society.
Right. So the Health Finance Corporation, the proposal that you and Michael put forward is built on the historical precedent of what we saw coming out of the New Deal era, World War II. So we're using history as a guide here in this sense. But Michael, I want to ask you about the role of history and the lessons to be learned and the lessons to ignore and to actually run away from. So in looking at leaders and these crises from the lessons from economic crises, how are policymakers making use of the past to make these important decisions in the here and now? And are they getting it right?
Well, I think they're getting it right in some ways. I think they're getting it wrong in others. The problem with the COVID-19 pandemic in terms of historical analogies is that it combines aspects of different kinds of things. In some ways, it requires something like war mobilization, as Professor Galbraith and I have argued. In other ways, it resembles a natural disaster. like Hurricane Sandy or Hurricane Katrina. And in other ways, the economic consequences of the shutdown, which was caused in the first place necessarily as a public health measure, resembles the financial crisis of 2008. My concern is, and I think this is shared with Professor Galbraith, the analogies that are being used are from recent history. They're not from the history of wartime mobilization, which really didn't take place that much in the Korean and Vietnam wars, much less in more recent wars. You have to go all the way back to World War I and World War II. And that just seems to be too much ancient history, I think, for policymakers. So their first impulse was to focus on the collateral damage of the public health measures, that is the shutdown, the economic crisis, and to say, oh, well, this is like 2008, 2009. We need a TARP. We need something like the Troubled Asset Relief Program. And we've seen the left and the right go back and forth, revisiting all of their arguments from that period, right or wrong, about, well, who gets bailed out, it's actually not a bailout, it's a rescue. It's a trying to freeze the economy from crumbling. But so I think there's that false analogy that this is like the Great Recession, which was caused by financial panic. If you look on the procurement side, we seem to be following by default the Katrina, Sandy, natural disaster model, where the states are first and foremost responsible, and then the federal government will back them up. Now that works when you have a natural disaster limited to one state or one region. When it's the entire country and world simultaneously, I don't think that model of the federal government just passively backing up state initiative is particularly effective.
So, we're looking to history is a guide here in terms of what to do and what not to do. And I also want to look at our comparative context. And Jamie, on this, I want to turn to you in terms of what has the pandemic taught us about our economic system here in the United States in comparison to that of other countries. And here I invite you to put on your professor's hat and grade us and our peers who are also enduring this pandemic crisis as well.
Well, we do have comparative evidence, and it's really fairly compelling. What it tells us is that, well, of course, the pandemic is a biological phenomenon, and it has a mathematical underpinning that's rather like the core of a nuclear reaction. If one person contaminates more than two others, that's going to expand explosively until there's the real meltdown of the society. If the reaction can be moderated and slowed so that one person is infecting fewer than one other person, it will eventually slow down. And the more rapidly you can do that, the lower the casualties. The two implications is that what matters is how quickly governments responded when they realized the extent of the threat, because the faster you get to this, the smaller the epidemic is going to be, and the fewer people are going to be infected, and the fewer people are going to die. We did not do well on that comparative standpoint, and we're suffering now many times the casualties that we could have suffered if we'd acted on a uniform basis at a much earlier stage, particularly since the pandemic did not start, it did not spread here initially. And you can see this in comparison with the Chinese case, where there were maybe 3,000 official casualties, maybe some more than that, and an undercount, but still, for a country 4 times our size, the pandemic was brought under control. It's being brought under control in Germany in a similar way. United States, France are probably the worst performers, according to the data I've seen. Italy and Spain also in very difficult position. The second thing that the data tell you is that within a few weeks, 2-3 weeks after effective measures, social distancing and separation, slowdown of the pausing of economic activity, of inessential activity, the spread of the virus does begin to slow. And so you begin to see a reduction in the fatality rates, and eventually they start falling. And that is a phase that we are about in just now. I saw that the governor of New York, I think it was yesterday, so that from that point of view, the worst may be behind us, particularly New Yorkers who are in the worst position in the country at the moment. So it does say that comparative evidence is fairly consistent on that. The penalty you pay for not having moved quickly enough is that you had to have a lot more casualties than you would have had otherwise. So that's the comparative record. I want to say a little bit about the. And it does say, okay, let's just talk, get to your question about what does it tell us about our system. I think a reasonable way of saying it is that we had developed a system that was highly individualized. Healthcare was adjusted to the range of ailments of a fairly wealthy society that focused away from public health, away from infectious diseases. Things were being run at a level of business efficiency with very small margins of excess capacity in a way that was not suitable for dealing with a public health crisis of an infectious disease sort. So we found ourselves without the capacity to, and then on the larger economy, globalization and very long supply chains, global supply chains meant that we become highly reliant on other sources of supply for basic manufactured goods and for basic medical supplies. And those chains were disrupted, and we ended up in a very tight situation in the first few weeks of this pandemic. So basically, efficiency is one thing, but it does not save you from vulnerability and fragility. And we found that countries such as China, such as Korea, Singapore, other places have had where they have short supply lines and were able to act efficiently and effectively and have the whole population pulling together either on a monitoring regime, which is what the Koreans did, or on a basically a massive quarantine regime, which is what the Chinese did. We're able to handle this with much more effectively than we have been able to do so far. So that's the comparative story. I'll say just a word or two about to back up what Michael said about the historical aspects of this. One piece of it was the reaction of my fellow economists who saw this in terms of the economic numbers and whose response, conditioned response over a generation or so to an economic downturn is to try and just get as much money into the economy as it possibly can. And while that has some function, and you obviously want people to have enough purchasing power to meet their basic needs, the reality is that it does not address very efficiently, or if at all of the needs that are there, and it doesn't deal with the crucial things. The crucial things, obviously, are medical supplies. We didn't handle that very well. And secondly, the need to keep people safe in their homes. And it would have been much better if, rather than pushing people onto unemployment insurance, they'd been kept on payrolls, discounted rate. Much better if we, let's say, provided a payment of their basic communications bills or some other utility bills that could have been done in a way that doesn't discriminate according to status, and you get some cash into people's hands without having to go through the Internal Revenue Service. Much better if we had not put people on unemployment insurance. Payroll protection is much better way to go. So lots of things were not done in the way that it was done in a way which reflected past practice, but was not well suited to the current crisis, in my view.
And what I'd like to point out to our viewers is that both Jamie and Michael have written extensively about this, and that we have on our website the links to all of their articles, their reports, their resources, where I know Jamie goes into detail about what should have been done or what can be done in the future. So I invite you guys to go to the website to check that out. We have a couple of questions, which we're going to get to in just a second, but I wanna wrap this conversation part of the session with a forward-looking question. What can we expect in the near to medium term future? And I think I want to parse this out into one in terms of leadership and also the economy, which we've touched on a little bit, Jamie, but Michael, I think I'll go to you first in terms of what can we expect moving forward? And then also, what do you think we need moving forward?
Well, in the last 24 hours, it's been reported that CDC and FEMA have their reopening the country plan, which seems optimistic to me, to the point of almost magical thinking that parts of the US can start returning to normal in the next month or two, maybe by middle of May or the early summer. And I haven't read the art, I've only read the descriptions of these plans in the press, but the premise seems to be that in the very near future, we will have up and running a adequate surveillance and testing system for millions of Americans in a country of 327 million people. I don't think that's going to happen. Neither the states nor the federal government have the capacity for this. This has not been really debated on Capitol Hill. It's not even clear what form the testing would take. There's some speculation that individual businesses, would test people's temperatures at the door to decide whether to let them be admitted, to the restaurant or the bar or the grocery store or whatever. So I think, to paraphrase Churchill, this is the end of the beginning of a long-term process. Probably we'll have some temporary openings. There could be crisis regional outbreaks, more shutdowns. And this is a kind of a chaotic period that could last for a year or longer. But I don't think most of our leadership thinks this is the end of the beginning. I think it's the beginning of the end in their view.
I think that's exactly right. And as I said before, there's a crisis phase, which we are perhaps coming through. We may be more than halfway through it at this point, not much more than that. And then there's going to be a containment phase, and it is certainly appropriate to start thinking about the ways in which you would begin to try to revive economic activity. But the reality is going to be that until we have an effective means of control, whether it's a kind of monitoring system that Michael described, which I agree is not, it's obviously not going to be rolled out the day after tomorrow or in a couple of weeks, or a effective therapy, which may or may not emerge, or a vaccine, which we know the timeline on is at least some months off, and perhaps more likely a year or so before we have that. So we have this period that is a very definite time period that's going to have to be managed. And then after that, there's going to be an aftermath phase. And the aftermath phase is going to be very strongly conditioned by the realization that how vulnerable we've been to a pandemic and how poorly we responded to it. But it's also going to be conditioned by a number of other things. People are going to be poorer. Their assets are going to be run down. Their houses are going to be worth less. There are all kinds of things that are going to be problematic. They won't be doing many of the things that they were doing in the pre-crisis phase. Secondly, there's going to be a pileup of debts. However much money is put into the system to help people meet their bills. Mortgages are being deferred, rent is being deferred, utility stoppages. Basically, one of the things that the CARES bill did was if you have a conventional mortgage on your house, it's basically you're protected against foreclosure and eviction for the duration of the emergency. It's my understanding of that law. And that means people are going to be using that funds, and properly so, to make sure that they're provisioned through this, which is what they should be doing. But then the question is, what do you do about the debts? And that's true of the small business loan approach. It's not a grant. If it's a loan, okay, maybe it's going to be forgiven, but maybe you won't be able to meet the terms. You're going to have to deal with that. Do you take it out? Similarly, many corporations are thinking, well, gee, the world after this is going to be different. If I'm running an airline, I'm not planning to open up and go back to previous levels of traffic. So I'm not going to need the same level of staffing. Some of them are saying, maybe I don't want to take a federal assistance, which is predicated upon a return to normal, because I'm confident that won't happen. So we're going to have to reorganize. I have to reorganize in fundamental ways. And let me add to this that many of our employees at our local communities work for state and local governments. Those depend on sales tax revenues, income tax revenues. Those revenues are down. Unless we do something to support those activities, we're going to find that public services are going to be very, very short funded. That's going to happen quite quickly. And those people the ability to maintain the basic fabric of our society is going to be challenged. So there's got to be a source of funding to support that, to support education, not to mention higher education. You can see this already in the future of our university. I mean, people are beginning to wonder where the money is going to come from. And unless we're able to sustain the basic functions and get through this and beyond it and deal with the debt basically right down, we're going to have a wave of foreclosures and a wave of bankruptcies in the aftermath, which are going to make it very, very difficult to have even an orderly reorganization of the economy. So the task before us is enormous. And it's good to start thinking about it. It's not good to promise that things are going to return to normal, that we're going to be back to where we were 3 months ago. This is just a flash in the pan that can be go away, because it won't. And then the third reason it won't is that people's values will change. They will not be so interested in taking risks that they might have not thought about before. They're very, very conscious of, and they may be more concerned about staying close to home, being close to family, generally reorganizing their lives. We can see this already in the organization of this seminar. We're doing things right now that we would not have done 6 weeks ago, and we're doing it because the technology makes it possible, but also because it becomes, that all of us feel that it's important to try and contribute something in this crisis. And I think many, many people will be doing whatever they can to contribute something that's going to change people's attitudes toward their economic lives in a fundamental way.
Thank you, Jamie. I want to turn now to some of the questions that we've gotten, and jumping off the point that you just made about what is our new normal and thinking through that. Let me read a question from Nick Baraka. There are some public health models that suggest we need to follow social distancing practices intermittently for a few years. Can you talk about what sectors will be hit hardest from a slow restart, the multiple startup and slowdowns, and what sectors will be fundamentally changed post-COVID-19?
Go ahead, Michael.
Yeah, I can take a bat at that. Manufacturing, any kind of mass production sector that depends on some sense of the consumer demand, unless it's very bespoke manufacturing, you can't just turn it up and down, right? So that will be hit. I think there's a real question with this start and stop model of affecting basic services which have not yet been significantly affected, including food delivery, water, electricity, all of these basic public utilities and necessities, which are staffed. We tend to experience them. The food is there in the store, the lights are on, the water system is working, but this requires great numbers of people. And if those people are getting sick and not showing up, or being afraid and staying home, or quitting their jobs, this could have a crisis effects that ramifies through the entire system. So I think we have to be very cautious about being too blasé about saying, well, we'll start up again, but then we'll just shut down, in the Southwest and the Northeast and the country as a whole if contagion spikes once more.
There's a whole class of essential workers who have been historically the least well-treated workers in our system. People who pick vegetables in the fields, people who stock the grocery stores shelves, people who run the checkout counters, people who provide security. All of this is at risk. And there's one of the first things that will have to happen is that, and it needs to happen now and should have happened, is that to prioritize the needs and care for these people, make sure that their health is protected, that their health costs are covered, that they're paid adequately for the risks they're taking, so that we can get through this period without having a larger social crisis. And Michael points to the utilities, the public utilities and public services, and it's everything from water and electricity to waste management, and everything else that needs to be protected through this. And as we think about this as a longer term problem, that priority becomes more and more central. You look beyond that, of course, I think there's some obvious things that are going to happen. I mentioned the airlines and other transportation systems. This is going to be a different world going forward. We're not going to be doing many of the things that we did before, people for the reasons I gave earlier. But you can think about this closer to home, and everything from a restaurant to a hair salon or whatever it is, there's going to have to be changes, which are going to affect the economics of operating those businesses. Restaurants operate with half the capacity because they implement social distancing inside. Then they're going to need to have a bigger takeout business or some other way to make up revenue. And they're going to have to adjust and reorganize. And thinking about that, I'm sure people are thinking about it very hard in a lot of different contexts. Governor of California said yesterday, quite accurately, that there won't be any mass gatherings, music festivals, cultural events, sporting events. All of these things are going to have to wait until the threat of contagion is behind us. So this is looking at a lot of changes in our lives over a significant period of time. On the bright side, well, if there's a bright side, there are lots of things that people will be needed to do. Michael just mentioned monitoring. I mean, it is the case today that if you go into any public building in China, you get your temperature taken probably multiple times by someone who's there with a remote thermometer, can point it at your forehead, get a reading. And this measures of control, monitoring of people's apps on their phones, so that's to facilitate contact tracing, is something that employs armies of people. Somebody needs to organize that, somebody needs to pay for it, which means it needs to be a public priority. But to have an effective, resilient public health system means you have to put resources into it, and you have to finance those, you have to pay for them. And so we're going to find, as we think about this and pursue it coherently, lots of structures of our lives which we've been getting by on, skimping on, are going to become essential, and other structures which we have enjoyed are going to become deemed inessential and are simply not going to recover. So we have to face those realities and really think hard about what's essential and how to make it work in a world in which we're much more vulnerable to this kind of thing than we thought we were.
So part of our new reality is that of the constant temperature taking, and I foresee in the short to medium term also that of testing. So I have a question here from Caroline Enriquez, who asks, is it possible to open the economy if more testing were available to better understand who is carrying / infected and who isn't, so that those who are not infected or carrying could participate more actively in the economy again?
Yes, that's exactly what the national plan should be. It's what the countries that have dealt with this the best, like South Korea, have done. Remember, the social distancing was not an end in itself. It was meant to slow infection until you could ramp up not only the treatment of people who had been infected, but to minimize it by identifying who is infected so they can be isolated and treated, so the people who are not infected can then go back to work. And so yeah, that the questioner has it exactly right. That should be the plan, to ramp up some system of testing and surveillance to let people who are not only not infected themselves, but not in danger of being carriers for this disease, can then go back to something like the new normal.
Yeah, there's another aspect of this, which may become available fairly, in the near future, which is a test for antibodies, so that you could discover if you have been infected and you may be resilient from further infection, and that will give some scope for beginning to reorganize economic activity. But of course, the reality is that the fact that you're not infected does not mean you're immune from infection. And quite the contrary. Those people are vulnerable. So the precautions are going to have to be taken until we can really be sure that we've either extirpated the virus, which we're a long way from doing, or that we have effective treatments so that we can minimize the actual cost of getting it, of catching it, or a vaccine that prevents us from catching it at all. Those things will come, but managing the period between now and then is much more of a challenge, I think, than has been acknowledged. And they talk again about early opening and getting everything back to the way it was is a fantasy that will be disrupted by the virus. So I don't have to argue against it. Useful if people paid attention, but the fact is the virus will speak on that question, as Dr. Fauci has said.
All right, we're bumping up on the end of our time, but just briefly, I wanted to ask each of you, Jamie and Michael, the magic wand question. So you have a magic wand. We're not going to solve this problem. It's going to be a long, entrenched one. But if one thing that you want to see put into place that you think can really make an impact, what is that?
Well, I think the greatest impact is Congress is going to do a phase 4 bill in a couple of weeks or in the next month after these 3 big bills. And they'll try to correct some of the problems of the previous efforts. I think they need to create some mechanism. It doesn't have to take the form of the Health Finance Corporation that Professor Galbraith and I have proposed, but and it's the original goal of the Health Finance Corporation. One of them was to ramp up hospital capacity and medical supplies. And as Professor Galbraith has pointed out, we seem to be slightly ahead of the curve there, for which we should be very fortunate. But the next phase has to be creating an apparatus in the United States that can do millions of tests and analysis and contract tracing a day. And I think that should be the priority, the magic wand.
Well, I'm going to offer an answer from a different perspective. I think that the truly necessary thing here is a very high degree of social solidarity, mutual support, common purpose, and understanding of what needs to be done so that everybody is pulling together. This is what got countries that have gotten out of this together. If you watched what happened in China, you can talk about what the government did, but what really happened was what the people did. And I have family there. I know we watched this very closely. It was a common effort by everybody to stay in their apartments, to have food delivered, to observe the guidelines, to wear masks in public, to do everything that was necessary to break the chain of transmission. And they got the rate of death down essentially to 0. And that is what is the, that's something that has been demonstrated. It's a demonstrated capacity in this country. We do have a lot of community spirit. We do have a lot of caring for our neighbors and our friends and our broader public. We do have a national, esprit, a national spirit that guides us. And so we can do this. This is something that, but this is the essential thing to carry us through this, is to hold together as a common community and keep the common purpose in mind.
Amen to that.
I think that we could not have asked for a more beautiful end to this session, and thinking about, we've got the economic numbers, we've got Health Finance Corporation, we've got testing, but at the end of the day, all of that is underpinned by social solidarity and of folks coming together. So I want to thank you both, Michael and Jamie, for taking time out. And for those of you who joined us via the live Zoom, I want to remind you that we will be posting this session up later in the week at the LBJ in the Arena website, in addition to all of the materials that speak to the economic crisis in COVID-19 that Michael and Jamie will be curating. For next week at noon on Wednesday, April 22nd, we have energy markets in the time of crisis. We hope to see you then. Thank you.
Thank you very much.
Thank you.